I'm still reeling a little bit from Tamara's talk. I mean, I've seen Tamara speak, I don't know, 5, 6 times over the years, and she's always riveting. But I'm still taking from that. That was so fantastic. Just so great. I wanted to start with a quote, and then I want you to guess who said it. I have no purpose to introduce political and social equality between the black and white races. There is a physical difference between the two, which, in my judgment, will probably forever forbid their living together upon the footing of perfect equality. And inasmuch as it becomes a necessity that there must be a difference, I am in favor of the white race having the superior position. Very loud. That was Abraham Lincoln. And the reason that I love this quote because it speaks to how deeply racism is embedded in the very founding of this country. The person that we celebrate is the great emancipator. Helped use public views. These are quotes from the Lincoln-Douglas debate in 1858, which are deeply speaking white supremacy. And when I started my work in public health, and I grew up in Canada, I talked a little earlier today in another meeting about the experience of going from Canada to the United States and to arriving in Baltimore. One of the things that sort of stood out to me immediately, shocking, was how deeply embedded racism is in the actual geography of the United States. It's literally printed into the geography. I always make the joke, because it's kind of funny. You grow up in Canada and you see all these American television shows and movies. One of the movies that you see most often has a basic plot of some hapless white couple, on the freeway who takes the wrong exit, ends up in the inner city. And then the rest of the movie is about how they are struggling to get out. And it's just, that's the whole plot. It's just getting out of the inner city. And the joke is, you could not make that movie in Canada. There is no place that is so horrifying, so devoid of resources and infrastructure and threatening in the sort of a cultural zeitgeist that you just couldn't make the movie. So this deep imprinting of racism into America, the most amazing thing to me about it, having not grown up here, is that it appears to be invisible to people. It's like people don't see it. They don't talk about it. It's not obvious. And when I was being toured through East Baltimore the first time I was here in the U.S., the person who was driving me around said, "What do you expect at the inner city?" And that has stayed with me for 30 years. Because, in fact, it's the fact that people expect that's the barrier that we're up against. It's that invisibility of it. It's the normalcy of it. It's taken for granted. And so I have the privilege, with my colleague Steve Eldred, who's here, working at the California Endowment on this really quite ambitious and in some ways crazy initiative. We were hired and told that we have 10 years and $1 billion. And we need to take the $1 billion and figure out how to measurably improve the health status of 14 low-income communities across the state of California, including City Heights here in San Diego. And the only caveat that we have is that we can't spend a nickel on health care. So that's what we do. And when we decided to do this work, we recognized that fundamentally what we're having to contend with is this deeply embedded, imprinted pattern of racism and discrimination that affects the whole geography of how people live their lives. And we recognize, working in these low-income communities, that we have to do 3 things. One is that we have to build power. Social, political, and economic power, and a critical mass of people living in these communities so that they can participate in rewriting the rules that shape the way that resources are allocated in their communities. Health is political. But we recognize that that's not enough. We also have to work on the policies and the practices that create those conditions in those communities. We have to look at the health consequences of non-health policies like education policy, land use policy, tax policy. Look at how that creates inequity in place in people's lives. And we realize that that's not enough. We have to change the narrative about health. And that's why I read you this quote. The narrative about health in this country has always been about individual responsibility and access to health care. And to the extent that you didn't have access to health care, it was because, as Tamara so brilliantly laid out, you were perceived as less valuable. You were perceived as not being worthy. And you only have to watch the Republican debate now to see that narrative just playing over and over again. It's about othering people. They're deserving people and they're undeserving people. So our practice in public health, and this is one of the things that I think is really challenging about this work, is you can understand it, but you have to know what to do about it. And what to do about it requires much more than our narrow, siloed approaches that we take in public health or health care. We actually have to work across disciplines in radical ways to create very new environments for young people and families to be able to thrive. But the root of that is essentially shifting from a narrative of exclusion to a narrative of inclusion. And that requires, as Tamara said on multiple occasions, it's really about naming it. It's about actively practicing putting the people who are most stigmatized, formerly incarcerated people, undocumented people, LGBTQ, as the spokespeople for how communities need to change. And it's hard work. We will attest to that. But it's fun. There's nothing I would rather be doing, and I will tell you today that we invite you to help us figure this out. Thank you.